A 50-year-old man with a history of alcohol-induced cirrhosis is brought to the emergency department due to altered mental status. A jerky, irregular flexion extension tremor involving his hands is seen with wrist extension. Which of the following is the most likely to be elevated in this patient's astrocytes? Now, this patient is going to be presenting with hepatic encephalopathy, and we can determine that from the fact that he has a history of alcohol-induced cirrhosis. He is presenting with altered mental status, and he has asterixis, which is going to be this jerky tremor that is seen in his hands with wrist extension. Now, the question is asking which of the following substances will be elevated in this patient's astrocytes. Now, our astrocytes play an important role in regulating neurotransmission within our brain, and they do this by uptaking glutamate. So, this green circle is going to be representing glutamate. They uptake glutamate into the cell, and this is important because we don't want too much of glutamate within the synaptic cleft because glutamate is a excitatory neurotransmitter. Now, our astrocytes are also going to uptake ammonia from the blood. And within our astrocytes, the ammonia and the glutamate can undergo a reaction with the help of the enzyme glutamine synthetase to produce glutamine. Glutamine can then be released into the presynaptic neuron. And in the presynaptic neuron, glutamine can be converted into glutamate with the enzyme glutaminase. Now, as you can see, this created a circle, and this is called the glutamine-glutamate cycle. And this occurs in our brain. Now, let's discuss what would happen if someone had liver cirrhosis, as with our patient in the question stem. Now, remember that the liver is going to be extremely important for metabolism of ammonia. So it is going to convert ammonia into urea, which is going to be then excreted out in the kidneys. Remember that ammonia is going to be very toxic to our body, so we want our liver to convert ammonia into urea to be excreted out. Now, if the liver is damaged, then there's going to be accumulation of ammonia because there's not going to be metabolism of ammonia, so it's going to then increase within the body. And this ammonia can then be uptaken by our astrocytes, and the excessive ammonia levels can then increase glutamine levels. Because remember that ammonia is going to undergo a reaction with glutamate within our astrocytes to produce glutamine. So if we have elevated levels of ammonia within the body, then we would have an increase in glutamine levels within the astrocytes. So the answer to this question is going to be answer choice E. Now let's discuss the significance of this. If we have elevated glutamine levels within the astrocytes, because glutamine is a solute, this is going to increase the intracellular osmolarity of our astrocytes. So what this does is it's going to draw in water into the astrocytes, and this is going to create astrocyte swelling. Now, elevated levels of glutamine within our astrocytes is also going to impair astrocyte release into the presynaptic neuron. So now we're going to have lower levels of glutamine within the presynaptic neuron. And because in the presynaptic neuron glutamine is converted into glutamate, we will ultimately have lower levels of glutamate. And this is really important because glutamate plays a really important role in excitatory neurotransmission in our brain. So if we have lower levels of glutamate, this is going to disrupt this excitatory neurotransmission, and this is going to contribute to the hepatic encephalopathy the patient is experiencing. So remember that with liver cirrhosis, we can have elevated levels of ammonia within the body. This will ultimately increase levels of glutamine. If we have elevated levels of glutamine within our astrocytes, this can impair the release of glutamine from the astrocytes into the presynaptic neuron. So this will ultimately decrease levels of glutamine. And ultimately, we will get lower levels of glutamate because glutamine is going to be converted into glutamate within the presynaptic neuron. And this decrease in glutamate can then impair excitatory neurotransmission in our brain, and this can contribute to hepatic encephalopathy. Now, I want to mention a mnemonic to help some of the features of hepatic encephalopathy. I realized that a lot of the features of hepatic encephalopathy starts with A, so you can remember this: altered mental status, ataxia, asterixis, as well as elevated ammonia levels are going to be all found in hepatic encephalopathy.